Değerli konuklar, programın ikinci bölümü için tekrar bir aradayız. Zararlı alkol kullanımını azaltmak için küresel strateji uygulamaları, Avrupa Birliği 2006-2012 alkol stratejileri uygulamaları ve bulaşıcı olmayan hastalıklar üzerindeki çalışmalar, direkt, indirekt alkol reklam ve promosyonlarının gençler üzerine etkisi, aile ve sosyal politikalarının alkol kontrolüne etkisi oturumlarını yönetmek üzere. Dünya Sağlık Örgütü Avrupa Bölge Yöneticisi Doktor Lars Müller ve İstanbul İl Sağlık Müdürü Profesör Doktor Ali İhsan Dokucu'yu buraya davet ediyorum.
Good morning. It's a great honor, Ministers, Director General. It's a great honor being here to chair this second session and also to introduce these prestigious speakers in this session. Yesterday we had a smaller meeting with official representatives of 43 member states in Europe exchanging information about alcohol policy. And I'm happy to inform that a lot is happening in Europe at the moment. And this is very much facilitated by new policy options WHO has developed. Please.
Hepinize tekrardan hoş geldiniz diyorum. İstanbul Sağlık Müdürü olarak açıkçası konumla bu kadar irtibatlı olduğunu daha önceden hissedemediğim bu toplantının tertibinde gerek Yeşilay'ımızın başkanına ve ekibine, gerekse Dünya Sağlık Örgütü'nün ilgili temsilcilerine bu toplantının tertibinde İstanbul'umuzun seçilmesi ve bu kadar kapsamlı bir toplantının gerçekleştirilmesi konusunda emeklerinden dolayı hepinize ayrı ayrı teşekkür ediyorum. Bugün ikinci sesyonu kısmı açıyoruz. Burada 6 tane konuşmacımız var. Süre açısından da bazı zorluklarımız var. O anlamda kendilerinden anlayış bekliyorum. 12 dakikalık bir süre kendileri için uygun gördük. Eğer uymaya çalışırlarsa değerli konuşmacılarımız memnun olacağım. İlk konuşmacımızı kendileri takdim edecekler. Buyurun.
And I'd like to invite the first speaker, Dr. Shekhar Saxena, to the floor. Saxena is Director of the Department of Mental Health and Substance Abuse in World Health Organization's headquarters and is responsible for the implementation of the global strategy to reduce the harmful use of alcohol. Please.
Thank you very much, chairpersons. I must begin by saying what a pleasure it is to be here today. And I would very much like to thank the Turkish Green Crescent Society for organizing it with very strong support from the government of Turkey and co-sponsored by WHO. And it's a matter of privilege that you have thought it proper to involve us in this meeting, which serves not only the purpose of Turkish government, but also serves the purpose for the region and for the global objectives that we have in mind. Since the time allocated is short, I would like to cover the subject that is assigned to me, that is the implementation of WHO's global strategy to reduce the harmful use of alcohol, somewhat rapidly. I apologize in advance to the interpreters, and hopefully I will finish it in 12 minutes' time. Could the chairperson alert me when 10 minutes are over? The global strategy to reduce the harmful use of alcohol, perhaps I should begin by saying the best thing that happened to the global policy on alcohol in the last few years. And it represents a unique consensus amongst all WHO member states on ways to tackle harmful use of alcohol at all levels. It was developed through a long and intense collaboration between WHO Secretariat and member states, all 193 of them at that time. Now we have 194. And it incorporates relevant and appropriate the outcomes of consultation with the stakeholders, including the industry and NGOs. In fact, I must say that NGOs played a very major role in crafting the strategy and also in making it acceptable to the member states. So we are really very grateful to NGOs, and we have just heard this morning the contribution that they continue to make, which we are again very grateful about. The definition of harmful use of alcohol, and mind you here, I am not using the word use of alcohol, I am using the word harmful use of alcohol, because that's what member states signed on. This is drinking that causes detrimental health and social consequences for the drinker, for the people around the drinker, and society at large. And we have just heard this morning in the session, there are multiple detrimental health and social consequences at all three levels. And it also is based on patterns of drinking that are associated with increased risk of adverse health outcomes, what sometimes is called hazardous use. And the level of pattern of alcohol consumption, including heavy episodic drinking, is one of the indicators which very clearly is correlated with harmful use of alcohol. What actions are needed to reduce the harmful use of alcohol? At global, at regional, and at national actions, the levels of alcohol consumption, the patterns of alcohol consumption, the context of alcohol consumption, and the wider social determinants of health are all very important to define what actions need to be taken, with a special attention given to reducing harm to people other than the drinkers and the populations that are at particular risk from harmful use of alcohol. So we're talking about people who are vulnerable and also people who are not drinking but still bear the brunt of harm because of alcohol use in the society and in the families. The global strategy recommended 10 policy measures and interventions, which are by now the real Bible or the Quran for the actions that are there globally. And it includes leadership, awareness, and commitment, health services response, community action, drink driving policies and countermeasures, availability of alcohol, marketing of alcohol beverages, pricing policies, reducing the negative consequences of drinking and alcohol intoxication, reducing the public health impact of illicit alcohol and informally produced alcohol, and finally, monitoring and surveillance. And these 10 target areas need to be tackled by countries depending on their context and local situation, and also depending on the feasibility of what they can do and in what time frame the beneficial effects can be obtained. The priority areas for global action versus regional and national actions are 4: public health advocacy and partnership, technical support and capacity building, production and dissemination of knowledge, and resource mobilization. These are the 4 tasks that are there at global level, which will facilitate reducing the harmful use of alcohol. The first one, public health advocacy and partnership, has gone ahead extremely well. We are very, very pleased that a lot of public health advocacy and partnerships have been developed in the last few years. And here are some examples of that. Global and regional networks for WHO's national counterparts were established. The first meeting of global networks was held in February 2011. Second meeting is planned for February 2014. And in between, the meeting of the Coordinating Council have taken place between these two. There was a co-hosting of the Global Alcohol Policy Conference in 2012 in Bangkok, and a co-sponsorship for this very symposium, which again we are very privileged and proud to have done. There are continued consultations and meetings with NGOs, professional association, international governmental organization, and economic operators. A series of policy briefs and fact sheets have been developed, and more are being developed. There are strengthened links with related areas like the NCDs, mental health, injury and violence, and communicable diseases. And I'll touch upon the NCD link in just a little while. The second area, technical support and capacity building. Again, we have made some very good progress. We are developing technical tools and training material for the 10 different areas. In-depth resource material for especially challenging areas have already been developed. Regional capacity building workshops have taken place at national and regional levels. Direct technical support to many countries have already been done, and continued implementation of the WHO's audit and assist packages, which are for identification and treatment of people with drinking problems within the primary care, are already very widely used. There is also the generic portal on alcohol and health, which have been developed and is being implemented in 4 countries to begin with, but we are hoping that many other countries will pick up and develop these web portals, which can be extremely influential in disseminating information at public as well as at individual levels. Production and dissemination of knowledge is another area where we are extremely active. The WHO research initiative on alcohol health and development has taken place. We have a large study on fetal alcohol spectrum disorder. There is study on harm to others, and also international research project on alcohol and infectious diseases is going on. We are supporting production and dissemination of new global burden of disease and alcohol as a risk factor estimates for alcohol attributable burden, and very soon we will see new estimates for doing that. We had a meeting of the WHO reference group on alcohol epidemiology just last month, and a full work plan has been made for the next 12 months. There is the Global Survey on Alcohol and Health 2012, which collected web-based data collection, finalized in collaboration with the regional offices, and a very successful attempt where 177 of the 194 member states responded, covering 98% of the world population. We are covering literally almost every country and every group of populations within this survey. And a global information system on alcohol and health is already operative, as you know, for a long time, and full integration with regional information systems have taken place in 2012. Alcohol Information System, which we generally call in short as GISA. Of course, there are regional information systems. There are 200 indicators, and data can be exported as Excel files for use by anybody. In fact, a large number of researchers are accessing these databases and making their own calculations about what is interesting for them. And this is the kind of help that we provide from WHO to facilitate research and assistance to policy. Definition of each of the indicators is there. Indicators are highlighted for the theme pages, and country profiles can be downloaded from the theme page. This we are actually very proud of, that country profiles are available in public domain, and they are being used by a variety of stakeholders in a variety of ways. The website address is there, and anyone can access that and make use of it. Global Alcohol Status Report on Alcohol and Health has been a tradition from WHO, and we are very happy to continue it. This is based, of course, on data which has been collected from the Global Alcohol Information System, and country profiles are there. The latest edition was launched in Geneva in February 2011, and we are planning the next edition for February 2014. Resource mobilization, unfortunately, is one of the 4 areas where we have not been that successful, and we really need to gear our act together to do more resource mobilization, not only for WHO, but definitely for the countries, because countries are spending too little time, effort, and money on alcohol policy, and we are really feeling that there has to be a great amount of increase in that, and perhaps we can take some very positive cue from Turkey, where we see this issue has been there at the highest level of the government, and they are spending a lot of resources for that. So thank you, Turkey, for your leadership in showing the way in this. There are many regional policy frameworks which are linked with the global, and there are many good things which have happened in Africa, in Americas, and of course, within the European region. Progress in developing national policies and action plans have advanced very well. 53 member states are in the process of developing a written national alcohol policy, and 39 are in the process of reformulating existing policies. 73 countries that have a written national policy, 37 have a national action plan for its implementation, and 22 countries have written reference in their national policy for global strategy to reduce the harmful use of alcohol. This is something that we are really very happy about and proud of. Lastly, a few words about the NCD action plan and the UN political declaration. As we know, harmful use of alcohol is associated with a variety of non-communicable diseases, and this has been one of the themes in the last 2 years, not only at WHO, but at the UN level. And we are very happy that member states are increasingly paying a large amount of attention on all the risk factors, including for alcohol. And in the NCD monitoring framework, a set of 9 voluntary global NCD targets have been identified, and one of them, we are very, again, happy to say, has been on reducing the harmful use of alcohol. A 10% reduction is envisaged. There is this one target and 3 indicators to suggest how we can make progress on that and can go forward with that. I come to my last slide, that is on conclusions. The adoption of the global strategy to reduce the harmful use of alcohol was a huge achievement on the parts of member states, and is reinforced by the UN Political Declaration on Non-Communicable Diseases. A global network of national counterparts and a coordinating councils have been established, and this is a major achievement. Structures and processes for monitoring and surveillance have been firmly established, and this is a good technical tool to look forward to make monitoring an integral part of our work in WHO and in the countries. Implementation at country level is really the key, and that's where I think we need to make more progress. Global achievements have been very good, regional achievements have been very good, but now the field is open for countries to make a good progress, and again, we look forward to the leadership of many countries, including Turkey, to take this forward. And resources, as I said earlier, are not really enough to make that kind of progress, and we really need to pay a lot of attention to that. Thank you again for your attention, and all of this and more is available on our website. Thank you, chairpersons.